You're listening to the Productive Therapist Podcast, the world's greatest and most brilliant resource for busy therapists who'd rather be laying on a beach in Hawaii. Every week we share helpful tips on where to put what, how to do this, that, and the other, and the best way to get your ducks in a row. And now here's your host, licensed therapist, head nerd, and productivity Yoda, Uriah Guilford.
Hello and welcome to the podcast. HIPAA compliance is a big part of any therapy practice. Sometimes people call a therapy practice looking for information about another adult, whether that's an appointment time or date, a progress report, or even just confirmation that the other person is a client. This brings up issues, as you know. Sometimes the caller may have a compelling reason to ask for the information. The question is, how do you handle these types of calls effectively and professionally while still complying with HIPAA? The training that follows is a staged intake call that will show you how an experienced intake coordinator deals with this situation. I hope you find some useful tips and phrases that you can use for yourself or your intake coordinator. Enjoy.
Hello.
Hi, my name is Trisselle and I am looking for Jackie Himagic.
Oh, hi, this is Jackie.
Hi, Jackie. I am calling you back from Intune Family Counseling. And you said you had a question for me. I'm hoping I can help you.
Oh, thank you very much for calling me back. Was it Tracy?
It's Trisselle, kind of like the Toyota Tercel, but it's Trisselle.
Oh, wow. You've done this before.
Yes, I have a time or two. Yes, I have.
Well, thank you for calling me back, Trisselle. I really appreciate it.
Sure.
My husband, Chris, is a client at your practice. I believe he has an appointment this week. I just need to confirm the date and the time with you, please.
Well, Jackie, I appreciate you calling, but unfortunately, I am not able to give out any information about any of our clients, whether they are clients or even if they're not clients. I apologize.
Okay. Well, I know for a fact he is a client at your practice. I mean, we are married.
Right. And I understand that. And it does seem like you would normally be able to get this information, but it is confidential information anytime you're asking about, records or appointments or anything like that, not only with a therapy office, but a medical doctor. There is a privilege that the client has. And so I'm not allowed to give you any information. That's something that you're going to have to ask your husband, Chris, about.
Okay. Well, this is really difficult because the reason I need to know is because Chris and we've been separated for a few months now. It's his week to have our daughter. And I need to know that she's going to be taken care of while he has his appointment. And he hasn't told me when that is. And I need to know because she's a minor and I've got to make sure that she's taken care of.
Right. And Jackie, you sound like you are a concerned mother and you want the best for your daughter. And I can appreciate that. However, it's not only illegal, I could actually lose my job if I provide you with any information. So I know, having been a child of a separation before and even a divorce, I know that is a sticky situation sometimes between parents. And my best advice is just continue to try to ask Chris for this information because I'm not able to provide any information about whether or not he is a client here. And I apologize. I know that's not the answer you were looking for, but I cannot provide you any further information.
Okay. Yeah. It's kind of spectacularly unhelpful.
I know.
I'm sure you can, it sounds like, this is an incredibly stressful situation. I just need to make sure that my daughter is taken care of. Right. And I don't know what he's been telling you. I don't know, what's in his notes, why he's not allowing you to talk to me. But, there's a minor involved here. We're separated. We're not divorced. He's still legally my husband. And I feel like I should have access to this information.
I know it does seem like that. But even if you were to go to his medical doctor and ask a medical question about him, that doctor would not be able to release any information to you either. And so don't take it personal. It is not you. It is any situation where you have somebody that is an adult over 18, even your daughter. As soon as she becomes 18, you wouldn't be able to call me for any information about her. And I know it's not helpful and I'm trying to be helpful. And I know it doesn't sound like it, but I apologize again. I am not legally able to give out that information and you're going to have to ask Chris about it. I apologize.
Okay. All right. Well, thanks.
Okay.
Yeah, I appreciate your honesty.
All right. Have a good day.
You too. Bye.
Bye.
I hope you found this example intake call super helpful. If you'd like access to more of this on topics ranging from dealing with an emotional caller to how to sell a more expensive or pre-licensed therapist, check out therapyintakepro.com. It really is the gold standard intake training course for therapy practices, and I know your practice will benefit from using it as well. Thanks so much for joining me. See you next time on the podcast.